Second, when we say there are 46 million Americans without health insurance, well, that's a little off because about 12 million of them are not actually Americans. They are non-citizens, about 6 million legal residents and about 6 million undocumented residents. So you know, right now, all the health care bills they're debating in Washington say they're not going to cover non-legal residents of the U.S., which means you're going to have at least 6 million people who aren't going to be insured no matter what you do. Now, again, we can have an interesting debate about whether or not we want to get them insured, but we should recognize they're not talking about insuring them in Washington. And if we did want to insure them, how do you go about insuring people who, you know, by the nature of their lifestyle are under the radar screen, working off the books and doing things like that, so, you know, trying to hide from the authorities? How do you get them enrolled? So it's a, you know, question that you have to consider. Third, when you tend to think that people are uninsured, we tend to think, well, these are poor people who can't afford insurance. Well, the real poor are actually covered by Medicaid. And if you look at the people who are insured, 43% of them have incomes above 250% of the poverty level. So they have incomes above, say, $50,000 for a family of four. Now, that's not rich, but it has some money. In fact, 15% have incomes above $75,000 a year. Many of these people could presumably buy insurance if they wanted to, but for one reason or another, they're not. And lastly, when we say there are 46 million or 47 million people without health insurance, we sort of have this vision that it means there were 46 million people who were born without health insurance, and 80 years later they die without health insurance, and they've never seen a doctor in between because they've never been insured. But first of all, having health insurance and seeing a doctor are two different things. The reality is that people without health insurance do see a doctor. And in fact, in terms of dollar amounts, we spend about 2/3 as much on the uninsured as we spend on people with insurance in this country. Now, it is also true that people without health insurance tend to see a doctor later. It means their condition is worse by the time they see the doctor. They don't tend to get the follow-up treatment, and they tend to have much worse outcomes. So it is a problem not to have health insurance, but it doesn't mean they haven't seen a doctor at all. We also know that simply putting a piece of paper in people's hands saying they have health insurance doesn't mean they've seen a doctor. For a lot of reasons, that doesn't necessarily mean they're going to go see a doctor. And we also know there are countries around the world that say they have universal health care, and yet people don't get in to see doctors. So it's not necessarily the same thing. It's just, oh, well, we'll say the magic words, you have health insurance, and suddenly the problem's solved. But equally important, when we say there are 46 million people without health insurance, that tells us that today, as a snapshot in time, there are 46 million people without health insurance. It tells us nothing about whether they had health insurance yesterday or whether they'll have health insurance tomorrow. And in fact, if you look at the uninsured, 40% of them are uninsured for 4 months or less. Only about 15% are uninsured for 2 years or longer. And the reason for this is that in this country we link health insurance to jobs. You get your health insurance at work. And that means for the working poor who cycle in and out of the job market, they're also cycling in and out of the insurance market. Today they have a job, they have health insurance. They lose that job, they lose their health insurance, and they're uninsured until they get a new job again, at which point they get health insurance again, and they stay that way until the next time they lose their job, and they keep going in and out of the insurance market and with the job market. Now, that's a problem that we need to fix. But maybe if we look back on solving that problem, if we recognize what it is, we think it needs a different solution than if we just think there's this huge batch of 46 million people that can never get insurance, never have, never will. So those are issues that I think need to be addressed. The lack of access and the uninsured and the cost of health care. We need to fix those problems. But at the same time, we need to make sure, as I say, we're not undermining the issues of innovation, choice, and quality that are good about the U.S. healthcare system. So with that context in mind, let me take you to the bills that are currently in Washington. It gets tougher and tougher for me to talk about this. What does the bill in Washington say? Simply because there is no bill. What you actually have right now, the House almost has a bill. It is 1,994 pages long, plus a 13-page addendum, and a 42-page manager's amendment that was introduced yesterday to be tacked on to the bill. And it's not completed yet. They are still actually writing additional manager's amendments that will be added all the way until they vote on it, theoretically, on Saturday. So we'll have to see what that actually does. second, there is also in the Senate Health, Education, Labor, and Pension Committee, the Health Committee. Someone actually sits around in Washington and dreams up these acronyms. But they have come up with a bill which was 527 pages long. And the reason it is so short is they simply left out anything to do with paying for the bill. They said, rather forthrightly, they said, that's not our jurisdiction, we'll figure out how to spend the money, someone else will come up with how to raise it. So we went over to the Senate Finance Committee, and the Senate Finance Committee went to work. They originally voted on a 223-page outline of a conceptual bill. This was actually learning for me. Did anybody watching learn that the Senate Finance Committee does not actually vote on legislation? They vote on conceptual legislation. In fact, for 2 weeks we watched them on TV voting on amendments. They weren't actually voting on amendments, they were voting on conceptual amendments to their conceptual legislation. Having done that, they turned that all over to someone else who wrote it up as actual legislation, and it came out to be 1,502 pages long. Now, that bill has now been scrapped, and Harry Reid and two others are now behind closed doors trying to write a completely different bill, which will be the bill that will actually go to the floor of the Senate to be voted on someday. Now it's looking increasingly like it won't be introduced until Thanksgiving and probably won't be voted on until Christmas, and we'll see what happens after that. But that's the current timetable. And then finally, there is a 3-page White House outline of what a health care bill should be. If you remember, about a month ago now, the President held a joint session of Congress to announce that he was now coming forward with his proposal on health care reform, and that night the White House did release a 3-page outline of what the proposal should be. So when I'm talking about the bill, basically I'm trying to put all of that together and sort of come out with what, but there are differences between them, and I'll try to make people aware of what those differences are as I go. They do have some common characteristics, and let me basically run through what those common characteristics are first. There is going to be an individual mandate. That is, there will be a requirement that everyone must buy health insurance and a particular package of benefits for health insurance. I'll come back to that in a moment. But you'll have to buy health insurance, and not just any health insurance, but a particular package of benefits for health insurance. Second, the House bill, but probably not the Senate bill, will include an employer mandate. That is a requirement that all employers must provide their workers with health insurance. Now, this does have a couple of problems in an employer mandate. Number one is it does sort of flunk Economics 101. Employers, they care about the cost of employing a worker. They're indifferent to how that cost is divided up. If they're going to pay $50,000 for a worker, they pay $50,000. They don't care how much of that is wages, how much is taxes, how much is health insurance, how much is pension, how much is a free parking space. It doesn't matter. It's the cost of employing that worker. So if you're going to mandate that they provide health insurance, you're simply adding in a new expense to that mix, and the employer is going to have to offset that cost in some way. And they can offset that cost by lowering wages, substituting in essence insurance for wages. Now, they're not going to actually cut your salary. What they're going to do is not give you that raise next year that you were otherwise going to get. Or they can offset it by cutting other benefits. They won't make a match to your 401k anymore, or they'll cut back pension benefits. Or they will cut back your vacation days or your sick days or something like that. Or they can cut back workers. They can lay workers off. They can not hire back the workers they just laid off because of the recession, or they can not make the expansion they were going to do otherwise. But one way or another, they're going to shift that cost back to the worker, and the worker ultimately bears all of that cost.